Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions and addresses the latest COVID news every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest headlines through today, the 10th of February. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Piskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
Now for some updated COVID statistics. In the United States, we're seeing a massive decrease in cases over the last 14 days. There's been a 63% decrease of cases. While celebrating 227,000 cases per day is nothing to celebrate, it is much better than the 1.4 million that we were seeing a couple weeks ago. The booster shot rate is about 26%, and this unfortunately has not been increasing. Hospitalizations are decreasing though by 30% in the United States, and in Illinois, they're decreasing by 41%. In the United States, we are seeing an increase of deaths in the last 14 days with a 4% increase. But fortunately, in Illinois, we're seeing the death rate decrease by 41%. And overall in Illinois, we are seeing very low numbers of cases. Yesterday in Illinois, there were 4,805 cases with a 7-day average of about 6,000 cases. What can you tell us a little bit about this huge decrease in cases that we're seeing? When is the death rate going to decrease in the United States?
Yeah, I mean, good point. This is just the natural epidemiology of this Omicron wave, which just skyrocketed during the middle of the Delta wave. And it went up so fast, and it's also decreasing so fast. So this is the same thing we saw in South Africa, same thing here. Basically, everybody at risk got it. And so those people are out of the system now because they're immune for at least 3 months. In other words, they won't get it again for at least 3 months, or the next variant. Now remember, Omicron came along and people had Delta and they got Omicron right away. So the immunity from Delta didn't help them much with Omicron. That's really unfortunate. So it's coming down, but that peak was so high that where it is right now, there's still 240,000 new cases per day, 111,000 people in the hospital, and approximately 2,500 people dying per day. That's way above most of the other peaks and everything. So, I mean, yes, it's going down dramatically, but where it is this day is like still, it's a very high risk period right now. And so we have to really be vigilant at this point.
Yeah, it's very unfortunate. And, you know, one of our big COVID headlines, well, touch a little bit more about that. COVID-19 cases are 1/3 of what the peak was 3 weeks ago, which is phenomenal.
Yeah.
Where does the US stand on other metrics that are currently going on? You talked a little bit about hospitalizations, about deaths. What else are we seeing with some of the numbers?
Well, you know, they categorize countries 1, 2, 3, 4. 4 is the worst. And like all these, they just added another 13 countries into group 4. But let's face it, the United States is group 4. If you travel to a level 3 area, you have a better chance of not getting sick. So I don't know what the issue is here with this. I mean, there's so much of it out there that it's just everywhere. The grading system is not helping anybody. People are traveling anyway. And there's a big difference what happens to you if you're vaccinated and boosted, or unvaccinated. There's 3 different kind of epidemics going on. So you have to all take that into consideration. We just sent a group of students down to South Africa that was just at the end of their Omicron wave at the beginning of January. It was like just skyrocketing here in the United States. They did fine. We even sent faculty with them. There really wasn't a significant problem. But you know, the United States is the pariah. We're the least vaccinated of the high-income countries, and we have the highest mortality rate. I mean, it's from a epidemiological standpoint, it's a disgrace how it's going here. I mean, we are no model to follow.
No, absolutely. And, speaking of other countries in the United States, our second big headline is that the CDC's highest risk level of travel, which is a level 4, is nearly packed with 135 different countries, including Japan.
Yeah.
Can you tell us about this level 4 list in the United States?
Yeah, no, it's,
globally?
well, I just pretty much already said it. I mean, they're adding all these other countries that had low numbers that are now spiking, like Japan. But it doesn't make any difference because the US is doing worse than they are. So, pick your risk.
Right. Well, absolutely.
Mhm.
And then for our last COVID
Pick your travel risk is what I mean. Yeah.
Right. Absolutely. Now for our last big headline, Pritzker says we should remove masks as soon as we can, considering easing COVID restrictions, as the cases are dropping in Illinois. So what can you tell us a bit about this mask removal conversation that is currently going on with governors?
Yeah, the Governor Pritzker announced yesterday, after the governors of New York and New Jersey did the same thing, that his team thinks that the modeling will show that it will be safe to remove indoor mask use by February 28th in approximately 3 weeks, 2 or 3 weeks. So that's the model. And he's, if you listen, I listened to the press conference and, it's if the numbers hold up, if they, in other words, if they continue to drop, that they can reduce that barrier. Now, that doesn't include the city of Chicago, doesn't include Cook County. They got their own rules. And private companies can do what they want. And the feds, they do what they want. And the feds are not changing. So, they only control interstate business and travel. So that's not going to change anything on trains or planes or, maybe even in public transportation, will remain to have to be still using masks. So I don't get really the big deal here about taking the masks off before we even hit the appropriate numbers, because the numbers are still so bad. Now, in 2-3 weeks, maybe those numbers will be improved so much that we won't have to do it. But I think I would keep my mask handy in my pocket, and I would not be comfortable in indoor spaces with a lot of people, particularly if the ventilation is questionable or not good. But still, I'm vaccinated and boosted. I don't feel that I'm really so much at risk if I get this thing. I'm not at risk for getting in the hospital. I'm not at risk for dying of COVID because I am boosted. And so everybody should keep that in mind, because this thing is so contagious, and this stealth Omicron is taking over. About 20% of all the Omicron cases are this BA2 sort of version of Omicron, and it's 50% more contagious. I mean, already Omicron was like 300 to 600% more contagious than Delta. So this is just like everywhere. You got to protect yourself. And that means getting vaccinated.
Yeah, no, absolutely. And now for some COVID questions. This individual would like to take her family to Disney World in late March. They are all fully vaccinated and boosted. Their 11-year-old is vaccinated, and their 5-year-old will get her second booster this week. How safe is it to go to Disney in late March with everyone vaccinated and boosted?
This is a great question. It's been a very common question. Families plan their vacations very far in advance, prepay, and people want to get out of here. This family is doing the right thing. They vaccinated the 11-year-old, and the 5-year-old who's just eligible to be vaccinated is getting a second shot this week. Congratulations to them. They should, by March, the numbers should be down. Of course, they got to watch. Maybe some other variant's going to pop in, but that could happen anytime. But yeah, they should be okay in March, and they should go. I mean, even though Disney Land or Disney World, wherever they're going, is or Disney World, excuse me, in Florida, the Florida situation is really kind of this anti everything anti-mitigation and prevention, but they're protected and they should go and enjoy themselves. Mostly Disney World is outdoors, it's a little bit, it's crowded. They can wear masks if they want to, but they're protected. And so they should enjoy themselves. And if the numbers are down, which I think they will be.
Absolutely. Now for our second COVID headline.
Mhm.
Can you please explain, if we remove masks, shouldn't that only be for people who are vaccinated? It sounds like they're just saying no more masks for anybody. How does that make any sense, Dr. Murphy?
Yeah, well, ideally, there's, like I said, there's three different pools of people. There's the vaccinated and boosted people. There's the vaccinated, unboosted people. They're close though. And there's the unvaccinated people. And then of them, there's the unvaccinated people who had COVID and those that didn't. So there's like different levels of immunity in the populations. And this person is right. Some of these groups probably don't need a mask. Now, the problem is when you look at somebody, you don't know if they're vaccinated or not vaccinated. And the unvaccinated people are the risk because they're so much more likely to get it and transmit it. So you just don't know. So a public health approach is just, it's got to be the whole group of people that you're looking at. So your city, your state, even counties, in the case of small countries, it's the entire country. The United States is so big, it's like multiple countries. Right. You have to really look at the different situation regionally. But anyway, it doesn't work basically to say if you're vaccinated, you don't need to wear a mask, even though you really don't. On an individual basis, you don't, but on a public health basis, you do.
No, absolutely. Now for our third big headline. What are the latest updates on the medication to treat COVID? We heard so much about them about a month ago and thought that they were supposed to be out by late January, but they haven't heard anything about them for several weeks. Are they prescribing them for treatment? Is it only in select few places? What can you tell us about the treatment for COVID?
Yeah, so good question, very timely. So Paxlovid is the Pfizer, it's a combination drug. There's actually two drugs in there. You take it for 5 days. It's, I think, 3 pills twice a day for 5 days. You have to start the regimen within 5 days of your symptoms starting, preferably earlier rather than later. And the only group that is found to really be effective, and it's effective in keeping people out of the hospital and keeping them alive, the only groups are people at risk for hospitalization. Because what happened when they just were giving it to everybody, if you could just give it to everybody, if it's all the young people or something, they're not going to end up in the hospital hardly anyway, or their hospitalization rate is going to be so low. So when you look at high risk, and the categories are immunocompromised person, any age, unvaccinated, 75 and older, unvaccinated with an underlying disease, and 65 and older. And then the fourth group is all unvaccinated people, 65 and older, whether they have symptoms or whether they have underlying disease or not. So those are the highest risk groups for severe disease and should be prioritized. Now, what the government did is pre-purchase this stuff, sent it to the states. There's Pfizer has 265,000 courses of treatment has been distributed. And state by state, it's basically a free-for-all. So you got to look in your state to see if you can get it. You need a prescription. And I know many doctors have tried to find it, and they're clueless. I haven't gotten any notice about how you get it. I've told a couple patients, just start calling pharmacies, and people do, and they find it. I've had a couple people get it, and but they had to go out and look. And there's many stories like this. So it's a real free for all out there. It's unfortunate, but keep in mind, if you're high risk, this can help you. It's like 90% effective. But you've got to take it early. You have to take it in the first 5 days to achieve the most benefit. Not that you wouldn't get a benefit afterwards, but it really drops off. They did 2 studies. One was treatment within 3 days and one treatment within 5 days. And so it really worked well in these high-risk people. Now there's another treatment also, sotrovimab, which is a monoclonal antibody. The Regeneron and Lilly ones don't work for Omicron, but this was the sotrovimab, which is I think GSK, that does work. Now that's given as an intravenous infusion. And so though that's available, but that's only like available in, you have to go to a hospital to get it because it's an infusion that takes 30 minutes, then you have to hang around for an hour. But that works very well. You know, you can get either one of those, particularly if you're high risk. So remember those risk groups I just mentioned, particularly, you know, immunocompromised people and elderly people in particular.
Wonderful. And now for our last COVID question. Okay, this individual's relatives all had COVID over the holidays and they stayed away from them for about 3 weeks. Their son and herself did not get it. They're fully vaccinated and they would like to see their relatives, but the relatives have decided not to get vaccinated. So what can you tell us about immunity, the unvaccinated individuals who are getting COVID?
Well, first of all, good for them that they're vaccinated because they're protected. Their relatives have had COVID, and it looks like the immunity from having COVID works pretty good for at least 3 months, maybe longer, but it's impossible to predict. So the general rule of thumb is that they're immune for at least 3 months. So after 3 months, she's got to consider them as high risk again. So the hope, maybe she can convince them that if they don't want to get sick again, particularly if there's a new variant coming, and there will be a new variant coming, that they should get vaccinated. And they can get vaccinated at any point after they had COVID, as long as their symptoms have gone away. And so ideally, you want to do that in that 3-month period, because then you'll get the immunity from the vaccine, plus you'll have the immunity from the COVID, and that's called a hybrid patient. And those people even have a immunity that's better than if you just had the vaccine. So that's the best immunity. So they should actually, hopefully she can convince them, but you know, maybe not. Some people have just decided they're not going to take this and they're going to play Russian roulette and let the chips fall where they may. And but that's a very dangerous thing. You know, over 900,000 people have died, and it's not just protecting yourself. If you get it, you could give it to somebody who is immunocompromised or elderly, and they could die. You'd be the person responsible for that. So it's just another reason to get fully vaccinated, your 2 shots plus your booster.
Absolutely. Thank you, Dr. Murphy.
Mm-hmm.